Hello, this is Dr. Owens. I'm here just to give you a little update on, a lot of people have been asking this question about accessing mental health services and whether they should see a psychiatrist or a therapist. First of all, a psychiatrist is a medical doctor, a person that's been trained in medicine who specializes in psychiatry. A psychologist is not a medical doctor. They have some of the similar fund of knowledge, but they don't know about the organ systems, the heart, the lungs, the kidneys, and how medications react on the body as a MD or a psychiatrist would know. A therapist is a mental health professional similar to a psychiatrist or psychologist, but their training is going to be limited and a little different. You have to make the choice of what you would need. My recommendation would be to start with the psychiatrist because you want to first be sure that there's no medical problem masking itself as a mental health disease, and you end up, you've got some hypothyroidism issue and you think you're just depressed, because if you have hypothyroidism that's causing your depression, if you don't fix the hypothyroidism, guess what's going to happen? You're going to stay depressed no matter how much therapy you go. So I would always start with an MD, psychiatrist first, and then, move to the therapist and the psychologist when you so choose. Step one, you got to figure out if you got a problem. If you really have a problem, accept the fact that you have a problem and just say, hey, I got a problem. I can't sleep. I'm not eating, relationships are failing, things are just going awry. Hey, do that quickly, move on, deal with it. The next thing you want to do, be prepared to become a little uncomfortable. Psychiatry sometimes is a little bit like surgery where we have to unlock the unconscious. And when you unlock the unconscious, it can become very, very uncomfortable because you have to go into some of that unforbidding territory. What happened when you were 8 years old, when your mom and dad divorced at age 10, that teacher or that coach that touched you at age 11. Just talk about some of those very uncomfortable things because those things kind of help us understand the pathology or the psychopathology that you're dealing with and why you have some of those behaviors that you have. Next thing, be prepared to dream outside of the sessions. You may need to dream. You may need to process a therapy. You may need to talk to others about what's going on. Not the deep, deep things, but just about how you're feeling. Next, you got to be prepared to accept your physician's or your psychiatrist's recommendations. You may have to, develop a treatment plan that can kind of help you get through what you got to get through. Remember, it won't be maybe 1, 2 sessions, maybe 5, 6, 7. It may be 1 year, 2 years. It could be 6 months. But be prepared to accept that psychiatrist's treatment plan and recommendations. And finally, you got to be prepared to change. The purpose of therapy is change. You want to be prepared to change. You don't want to just go into therapy, because a lot of us got hidden and dark secrets that need to be illuminated. So that's why you come to see the psychiatrist, so we can talk to you and do what needs to be done to sort of help you. Remember, what it looks like on television is not necessarily what it's like. Sometimes on television, they produce the film, they cut it down, they put in, they put out. So, an hour or 2 or 30 minutes of horrors is not what it may be really like when you actually see a therapist. So, why do I need to seek professional help? Let me give you 10 reasons you may need to see a mental health provider. Number one, a lot of unresolved conflicts with childhood. Number two, you're morbidly obese and you just can't seem to get, deal with it. A lot of times we see eating disorders and anorexia nervosa. Of course, with anorexia, you've got to see somebody. But a lot of times when you're fat, obese, you're trying to diet. People say, yeah, you can be big and healthy. You're right. But you may need to see somebody because you could be eating the pill of nature, emotional pain. You're always sad. You're always sad. You're always down. You're always dreary. You're always mad. You're difficult to get along with. People's like, I don't like her. She's a nice person, but I just don't like talking to him or her because they have a nasty attitude or disposition. And they're always going off on people. That could be a problem. You can't seem to get life right. You change job after job after job after job. You go from church to church to church. You're a church hopper. Hey, that could be a sign that there's a personality issue there. You continue to get into bad relationships. All your relationships fail. None of them seem to work. You've been married 2, 3, 4, 5 times. It may be something wrong with you, my brother or my sister. You hate your mother, you hate your father, you hate your sister, you hate your brother. You hate everybody. Nobody's right for you. Everybody's got a problem except you. You're conflicted about your sexuality. One minute you're dating women, next week you're dating men. Vice versa. You don't know whether hey, which side your bread is buttered on. And finally, you stay in abusive relationships. These are just a few things that, could point to that you may need some help. So, hey, feel free to go to my website at www.drowensmd.com, owensmd.com to see if you may need some help, or go to my website at my blog at www.AskDrO.com. That's AskDRO.com to just surf it a little bit and find out if some of those disorders meet you. Have a wonderful day, and if you need me, call me at 404-575-4785. Nice small consultation fee. We'll talk to you. Good day.